Now, common household products are helping to fuel antimicrobial resistance. Monash University researchers have found that almost 1 in 3 antibacterial products sold in Australia contain ingredients linked to drug-resistant infections.
They were found in hand sanitizers, eye drops, throat lozenges, mouthwash, soaps, disinfectants, toilet cleaners, wet wipes and more. Let's speak now to Dr. Francesca Short from Monash University, who's the senior author of this study. Good morning to you, Dr. Short. Were you surprised by just how many products were found to contain this ingredient?
Hi. Yeah, we were a little bit surprised. We were also surprised with the distribution of the problematic ingredients. Yeah, so in this study we looked at a lot of different products that people might buy to protect themselves from germs, including cleaning products and personal hygiene products. And we're particularly worried about long-lasting disinfectant chemicals because they're more likely to cause the kinds of microbial adaptations that can make bugs just a little stronger across the board and then cause antibiotic resistance down the line. And so, yeah, we were a little surprised.
Yeah, so tell us more about the potential consequences of these products being used so readily.
Well, the problem is with bacteria, then they're very, very good at adapting to new kinds of stress and new kinds of threats. And then some disinfectant molecules, not all of them, most of them are actually fine, but just some of them can have these unfortunate off-target effects where they push bacteria to become a little stronger in ways that allow them to resist antibiotics as well. And so that means that, you know, if we keep using these products, then there's a possibility that down the line, bacteria that have been exposed to them might cause an infection that can't be treated.
Now, during the COVID pandemic, we became so much more aware of sanitising everything. You know, every shop you passed, there would be a hand sanitizer pump out the front or different dispensers that you could use. Did the COVID pandemic make this issue much worse?
Yeah, absolutely. I think that we were all told to kind of sanitize and disinfect everything to protect ourselves and our families. And then that did mean that people started using stronger ingredients perhaps when they weren't needed, like just for simple domestic cleaning.
What's your advice to consumers to ensure that they're not contributing to this issue? Because obviously on these products, the ingredients lists, they're very long and they're really hard to decipher.
Yeah, absolutely. That's a real problem. And consumers already have so many different public health messages to keep on top of. So our advice is just to use simple soap and water wherever you can. And for cleaning products, then using things like citric acid and lactic acid active ingredients, and they're usually listed on the front, so it's a little bit easier. And then hand sanitizer is still fine. Alcohol-based things, it evaporates really quickly. It doesn't hang around to cause these effects we're worried about. And so we think that hand sanitizers are generally okay.
Do you think more needs to be done to assist consumers, whether it's through education or regulation?
Well, overseas, then there are some countries that regulate disinfectants in terms of how likely they are to cause antibiotic resistance down the line, and we would like to see that kind of thing in Australia as well, yeah.
COVID did bring more awareness around sanitation, as we mentioned. Do you think we need to have a bit of a cultural rethink about germs and how we live alongside them?
Yeah, that's a good point. I mean, I think that public understanding keeps getting better, and a lot of people understand that most germs are not harmful and we don't necessarily need to use hospital-grade disinfectants all the time. But yeah, it is a difficult balance because at the same time it's important to protect ourselves from COVID and other nasty diseases.